hello everybody, good afternoon. Welcome to our workshop and webinar. So just a few housekeeping things to start with. We're going to produce a resource pack from this. So if there's things you don't catch as you go through, we will send those through. Best thing to do, I think, is if you pop in the chat to say you'd like a copy of that, we'll go through that afterwards, pull it out. And I think, Olivia, we can get that to people through the email addresses through which they registered. Brilliant. Okay, so we'll get that out to you. The session is sort of up to an hour. So the idea is we've got 4 sections. The first section is the longest. We'll go through, and then after each section, we will stop to pick up a few questions that have come through. So again, pop them in the chat. Things we can't answer as we go through, we will try and pick up afterwards. And if there's sort of the same questions coming through, again, we'll make those answers available in the resource pack. I'd also just like to welcome a few people, because we've got Ruth Dawson-Jones on the call as well. So she'll be helping us out, hopefully, in one of those sections. We've also got Joanna Keepax from Why Sleep on the call. So she's contributed some material on sleep. And I've also got Tabby here with me, so she works with me in the company. We also have a couple of newsletters, and I'll just mention this now so I don't forget at the end. We have a couple of newsletters that we send out every fortnight. There's one for HR leads and wellbeing leads, and there's also one for personal development. So if you want to be on either of those, again, please let us know in the chat. So just a bit of background on me and why I'm here and doing this, just so you know where I'm coming from. I actually trained as a mechanical engineer in the automotive industry back in the 90s, but most of my career has been in project process and systems management. Worked for some very large companies, from very small companies, and some local authorities. And it's actually an encounter with my own mental ill health, or a brush with it, if you like, about 10 years ago, that I switched to helping individuals privately and through organisations to improve their well-being and mental health, and to have skills for living a good quality life. So, and I'm an advocate of a proactive rather than a purely reactive approach to mental health. So hopefully you'll hear that as we go through. And I talk about wanting to raise the baseline of well-being, so that we're all just operating at a better level rather than waiting for people to have a problem and then dealing with it. Now, one of the other elements of that is a reduction in suicide. And actually, that's where I'd just like to come in. So it might seem a bit of a morbid place to start, but I think it's quite important, because clearly there's a very, a rapidly increasing death rate from the virus, and that's very worrying, particularly if it's your own friends and relatives, people that you know that are being impacted by it. But it's just worth remembering that in 2020, the death rate for the coronavirus will have overtaken the other primary cause of death in the UK, and that is through suicide. And in a way, let's keep it that way. So what we don't want to see is an increase in the death rate, not through the virus itself, but through the impact of the mental health that comes as a result of the circumstances we find ourselves in. And we've all got a responsibility to help ourselves and to help those that we work with and that we serve in doing that. So we've got 4 sections that we're going to talk through today. The first section is the longest, and it's how change and uncertainty affect our mental health and how neuroscience can help. I'm going to do some slide sharing here and other notes. I've got my own notes as well, so we'll see how that goes. We'll try and get the balance right. So let's just do that now. So I'm going to share my screen, hopefully. How do I do that? It's gone. Just bear with me a second. Screen share. There we go. And share. Okay, that was most of the workshop you've just seen. Right, there we go. So I'm just going to talk about this for a few minutes now. So I take a very simple approach to mental health, and that is good mental health is when we are paying more attention to thoughts, feelings, and emotions that we consider to be positive than negative. And fundamentally, that's it. Doing that is a different challenge altogether, but that's the way I simplify and think about mental well-being. Now, we tend to have a negativity bias, so it's sort of 3 to 5 times more we'll focus on the threat side of things than we will the reward side of things. So in order to maintain good mental health, we need to increase the amount of focus on the positives, the reward, decrease the amount of focus and occurrence of the negative on the threat. Now, clearly at the moment, we're in a very high threatened state. There's a huge number of things that are going on. and that impacts us in a number of ways. So I've got 5 of those identified on the screen there. So uncertainty, control, status, fairness, and disconnection. When those are all challenged, we feel a sense of threat. That's going to tend to reduce our resilience and put us into a higher state. And just while I'm talking about that, I used to be a member of the Neuro Leadership Institute, and they've got some great webinars at the moment. One of the models they've created, called the SCARF model, underpins these 5 elements. But they also talk about 3 levels of threat that we can tend to be in. So, well, most of the time we're in reward, we're doing things which are constructive, but then we can go into level 1 threat, which is there is sort of some impending issue that we're concerned about. Level 2 threat is it's coming upon us, and level 3, we're in the middle of it. And the further down that scale we go, the more challenging it is for our mental health. Now, at the moment, or most time, we'd be in somewhere between reward and level 1 threat, because maybe we've got a deadline coming up or there's a particular challenge at work. But at the moment, we're sort of hovering around level 1 and then dropping down to level 2 and level 3, imminent danger all the time. And that's very tiring and risky for us in terms of our mental health. So the question is, at the moment, what sort of things tend to instigate that threat response for us around those 5 subjects? And more importantly, what can we do to mitigate that given the circumstances? So let's just have a think about the cause of threats for a minute. So uncertainty, how long is this going to last? Who's going to be affected? What will happen to our businesses and our livelihoods in the as the economy starts to pick up? What about control? Well, there's very little control over what we can do. We're not able to go out like we were. We can't buy the sorts of things that we did. So much of our sort of expected and normal daily lives have been changed around. And what about our status? Well, have we got jobs at the moment? So there's an incredible range of impact it's had on people. Will we have the same sort of business going forward, or even the same job? Can we bring in even enough to cover the bills? So there's a status there in terms of how we feel able to provide for ourselves and our families. But what about fairness? I think this is tricky. Although this is happening to everybody at the same time in the UK, and not just in the UK, but right across the world, it's impacting people in very different ways. So some people are now out of a job, or their businesses have shut with maybe no hope of that recovering. They find they've got no income and no opportunities. Other people are being furloughed and they're at home. They've actually got time on their hands. They've got some money coming in. They might be volunteering. They might be spending time with their families. And then there's others who are, able to work from home, and others that have never had as much work or are out there supporting us through the NHS and through, the essential retail stores, etc., and actually putting themselves at risk. So we've got a massive range going on in terms of people's circumstances, and there's a degree of fairness. Now, I think the difference is nobody feels like it's being done to us, certainly at this stage in the proceedings. We're all sort of in the same boat. But I know, for example, myself and my own business have fallen between the cracks somewhat in terms of the Chancellor's support for businesses, and you're sort of looking, thinking, where does that leave me? And then we've also got disconnection from people. We're very used to being connected, and we suddenly find ourselves in a situation. And even the phrase social distancing, I did wonder of questioning it at the beginning and saying, should we call it physical distancing? But actually, the important thing is that we do keep away from each other. But it isn't about really being socially distanced. We're trying to do the opposite, aren't we? We're trying to increase our social connection at a time of physical disconnection. So those are the 5 threats that we can feel at the moment: uncertainty, control, status, fairness, and disconnection. So really the question is, what can we do to mitigate those issues? How can we improve that situation during this time? I'm going to think about these in 2 areas. So there's a work environment, what we can do as employers, and then there's the home environment, what we can do for ourselves. So what about certainty? Well, we can do things like putting in regular briefings or communications. We might not know exactly what's going to happen in the wider world, but we can put in staging points to say, every Friday we are going to communicate to you what we do know. We can't give you all the answers because the answers aren't out there, but as far as we know, we will. And that sort of starts to deliver a certain amount of regularity and create a degree of certainty. to say you may not have those answers. It may be that you've got your own COBRA meetings going on in your businesses, but you can create that sense of routine and order over the top of the chaos that's going on. And things like having regular morning Zoom check-ins with the team so that they know every day or every few days there's going to be that check-in, that conversation, that creates a degree of certainty. And at home, particularly if you're working at home, it's about regular sleep times, regular wake times, regular times for exercising, actually just putting in those routines that give you that degree of stability within the day. I will say that, but I'll also say, we are in unprecedented times, and I don't think it means that we should totally control our lives to death, if you like. I mean, there's a certain degree of flexibility and freedom that comes from working at home, and I think it's fine for us to enjoy that. So that's certainty. Let's have a think about control now. So in the working situation, we can give people guidelines and frameworks, not just rules, and that's quite important because things are changing so quickly that we need people to be able to trust the people that work for us and for them to make their own decisions given the circumstances. So as much as possible, it's sharing the principles and the guidelines as to how we do things and allowing them to then make the decision as to how those are turned into rules. Not necessarily having set working hours, perhaps having core working times if you've got people that need to be working together. And then that gives people a sense of control over their own day when they've got so little control over other things. And also making sure there are good upward channels of communication as well, so that people's voices are heard and they feel that they can contribute towards the conversation that's going on. What about at home? Again, routine. And also, I was thinking something like learning a new skill. That again puts us back in the driving seat as to what's happening in our lives. So we've talked about uncertainty and control. Let's have a think about status now. Actually, can I ask, can you see me while I'm talking, or am I just talking to the slides at the moment? You can see me. Oh, Olivia can see me and other people are nodding, right? So you can hear me and see me then. There you go. Okay, so let's think about status for a minute. So I think one of the big things in a working environment is about compassion, and this came very strongly out of the neuroleadership research, is that under these circumstances, having compassionate leaders is really important because people are going through so much challenge and turmoil. So compassion, and I think when people are compassionate to us, that does ease us in terms of that, the threat in as far as that relationship's concerned. Asking for people's opinions, not keeping people in the dark, and regular communication at all levels of the organisation. And at home, asking for the financial help that's available, making access to that. Perhaps if you find yourself at home not certain if you're going to have work, then spending some time looking for new opportunities. Connecting with others in a similar position so you can share your experiences. And actually finding the ways to use the skills and knowledge that you've got, particularly if you're furloughed, that could be valuable to other people. So you might not be able to work for your employer at this point, and employers can still communicate with their employees about this, but there may be ways in which they can volunteer and use their skills and feel a sense of status as a result of doing that. So what about fairness? What can we do about that? Well, I guess at work, it's just being aware that not everybody's in the same position. We can't necessarily do very much about it, but just accepting that and being good at communicating. So remembering these are challenging times and there aren't any simple answers, and that we are all in this together, and that's not just in our companies or our country, but globally. And that the virus is amoral. I don't know if that was quite the right phrase for it, but it's no respecter of persons and is actually a great humbler in a lot of ways. So as far as fairness is concerned, in a way that, it seems to be just, it doesn't really care who or what position the person's in. And what about at home? So I'm going to say here, don't let guilt stop you enjoying the benefits that you might be experiencing. Because I know that, I'm very conscious that there are people, and, on the odd occasion I've been out to the shops, there's, you see people from the NHS who've got friends that are working in the NHS in the emergency units, and we're in touch with them. And it's a really challenging and distressing time for them. And I don't really know what to do with that feeling, but it doesn't really help them if I'm feeling bad about it or feeling guilty about it. So I am going to enjoy the sunshine that we're having. We're blessed in having a decent sized garden. It's not going to do me any good feeling guilty about that either. So it's just, but it, you know, I do feel this pull. So it's this challenge. So I'd say, in fact, I did a blog post yesterday about gratitude. So it's fine to be grateful for the things that you do have. That doesn't take away from the challenges that either you or other people are facing, but it does help balance it out. And to be honest, if you're in a good position, then you're in a much stronger position to help other people as well. And on that point, just be sensitive about others and the sort of help that they might need and the way that you might be able to help them. Excuse me a second. So the fifth one on there was disconnection. So we are social beings. That's in fact, there's a book on the shelf here called Social by Matt Lieberman, who's a member of the Neuro Leadership Institute as well. We're built as social beings. So this is a very strange environment to find ourselves in, and one that it does come across as a threat to us. So how can we deal with that? So at work, it's communication. Communication has come through multiple times in this, having these regular Zoom calls. Considering perhaps a buddying system. Now you could either do this as a one-to-one buddying, so as in pairing people up, or almost like a daisy chain where everyone looks after someone else, just to make sure that in addition to the standard hierarchies that you've got in the organisation, that perhaps you've got a slightly enhanced peer support system going on as well. And I'm going to mention that later as well when we talk about specifically around the mental well-being. Because I think that can be really helpful and also take some of the strain off managers who themselves are going through the situation, who themselves are in that position as far as their own teams are concerned, and then are also trying to provide that support for their teams below. What can you do at home? Similar things. It's those regular Zoom calls and spending time with the people in your house. It's a sort of a very strange situation that we find ourselves in, isn't it? But the risk is that we spend so much time communicating with everybody else on the internet that we forget that there is an opportunity to reconnect with the people that are in our house. Although that in itself can be a challenge for people too. So those were the five. I've got a few more points on this topic, but those were the 5 main points I just wanted to talk through. But before we move on, I want to think about maximizing reward. So this was all about minimizing threat. I said there were those 2 elements: maximizing reward, minimizing threat. So maximizing reward. If you are furloughed, making the most of it, enjoying the weather. If you've got a garden, enjoying the lack of pressure and business if you find yourself without it. Enjoying the connection with close family and friends. Enjoying the opportunity to work from home. I think it's interesting. I've worked for a number of organisations or consulted with them where, working from home has been something that they've toyed with or thought about or dipped their toe in, and suddenly, like immediately. Everybody's working from home. So it's going to be really interesting how we come out of this. And that can work really well for some people. I know personally, when I was working for large organizations, working at home for more than 2 or 3 days without getting into an office, I found quite challenging and disconnecting. But yeah, so it suddenly find ourselves in that position. So enjoy the benefits of that as well. And I quite like this phrase. I didn't realize, Tabby found it the other day. It was from Winston Churchill. I thought I'd made it up, but Winston got there first. It was never waste a good crisis. And I just think that's really quite helpful, because in times of significant change, there are also significant opportunity. And it's helpful just to remember that. Just a few other points on this. Don't constantly watch the news. It's very easy to do that. There's very little that you can do about it. I found myself with Boris being in intensive care, I was checking the news sites every sort of few hours to see how he was doing. That wasn't particularly helpful. It didn't help him, didn't help me. I guess I was concerned, but maybe just once or twice a day, catch up on what's happening with the news. Perhaps set times for doing that. Just as an example of that, I was having some trouble sleeping, and I had a chat with Joanne, who's some of the material I've got from Joanne in a minute. And one of the things she said, because I was checking my Fitbit in the morning to see if I'd been sleeping well, and she said, "What are you doing as a result of it?" And I said, "Well, if I've not slept well, then I know because my Fitbit's told me." And so, "What are you doing about it?" "Well, nothing different from what I would normally do anyway." So I stopped checking my Fitbit to see if I'd been sleeping well. So stop checking the news to see how the nation's going too much, because there's quite a bit of it you can't do anything about. Remember that routines are effort. routines are there because they reduce effort, and in these periods of disruption, we have to put a lot of time and energy and thought into creating new routines, and those are effortful and they are tiring and they take our cognitive energy. So if we've got less time for our normal routine work, because we've been sort of trying to deal with all the challenges and changes, then that's perfectly acceptable. Just, you know, be conscious of it. I just wanted to talk as well about scenario planning. There's a suggestion that, you know, it's very difficult to do planning in this situation, partly because we just don't know what's going to happen. But there's a suggestion that we do take some time, if we're in a sort of leadership position, to pick 3 scenarios and just really go deeply into those scenarios, and just sort of make some points about, were this particular situation to happen, what would we do, and then come out of it and then go into the next one. And I love the quote. It's, planning is useless. Plans are useless, but planning is priceless. So it's not about the plans so much, but the process of thinking through how things might transpire. Okay, so those were the main points I wanted to mention on this section about opportunity and about change and challenge and the elements that neuroscience can bring to that. So have there been any questions come up in the chat as we've been going through? No, that's quite simple. Has anybody got any questions?
Can't see any questions at the moment, but maybe a good time to pause and allow anyone to ask any questions if they want to. If anyone's got anything they want to put to Jon, then pop it in the chat. Just give everyone a minute just to type it out. Okay, I'm going to go with a no for now then. Jon, do you want to carry on with your next bit?
Indeed. Okay.
Oh, Jon, we have had one. Sorry, this always happens. I move on and then we get one. Can you see it, Jon, or do you want me to read them out?
So how would we cope with someone who is already suffering from depression? I think that's a really good question. I'm actually going to touch on that in one of the later sections, probably better, because we're going to talk about specifically about the mental ill health situation. This was really a backdrop to that. But I want to take the point there just to say that this is the challenge, that people are already on suffering from a mental ill health condition or on the cusp of it. These are very challenging times. And it's, I guess, more likely that people are going to feel themselves pushed in that direction if we're not careful. So being particularly vigilant at this time is important. So if I don't answer that question properly in the next section because I forget, then please feel free to raise it again. Okay. So we're on to help for homeworking and feelings of isolation. Oh yeah. What day is it? Was one of my questions. I don't know about you, but you sort of wake up thinking, I don't know if you've ever seen the sketch that Michael McIntyre does about Christmas. And he says, what day is it? Are the bins due today? Can I park on the, oh no, we're not going out, but you know, it's that sort of question. And some days I'm thinking, yeah, what day is it? So what sort of things have we got on this? So it's partly about, oh yeah, so at this point I'm going to hand it over to Ruth, who is hopefully still there and able to contribute. Ruth, are you on the call? Olivia said, make sure you give me a few minutes to get logged in.
Yeah. Hold on, can everybody hear me?
Yeah, hi Ruth.
Super, hello, hi everybody. So I have come into being a self-employed person in the last 12 months or so, so I'm also in a situation where I'm getting no help, so I'm hoping that helping you guys out in this situation will make me feel better about not being able to do all the things I normally love to do. I'm also in a situation where I'm homeworking and looking after a 6-year-old. Homeschooling is not as fun as people make out, and it's quite difficult. The first 2 weeks were not too bad. This week, no work wants to be done. So it is really, really, really hard. Apologies, by the way, there's a slight typo in this one. It should be furloughed with a rut in it, and we'll get that corrected. So regardless of whether you're home working or furloughed, we're looking at making sure you keep some kind of a routine going to help you keep sane. What is your normal day? What is it going to be? It doesn't need to be exactly what you used to do, but it does need to be something that you recognise that you are working your way through a day. Whether that's getting up and making sure you do get dressed, whether that's getting up and making sure that you have some breakfast and do something that is something you would normally do on a normal day, whether that's reading the news, limited amounts, going to somewhere that's not just full of coronavirus news and finding some other news stories that uplift you, whatever it is you'd normally do. Stay connected to whoever it is that normally provides your support. So there may be people in your home who do, but there's also people outside of your network, your colleagues at work, your other business people if you're in business for yourself, other wider networks that you might have, family, friends, anybody that you can think of that is actually going to be useful and helpful to you in keeping connected with the real world. It sounds really simple, but it's actually really hard to do. I'm a relatively social person, but I find connecting through these calls really hard work. We've had some virtual pubs with some friends, but I just find them quite draining. But I do still have telephone calls, which I would have done before, and I find those are better. So find the thing that for you works, and make sure that you keep those connections going. Clarify your expectations. What is it that you're expecting yourself to do? What is it that your employer is expecting you to do if you are trying to work? If you're furloughed, are there opportunities for you to do some volunteering work? Are you allowed to do that? Does your employer have any restrictions on what you need to do? So if you're not sure about something, find somebody who can answer that question and help you with it, and answer the questions rather than sitting there worrying about something that actually there might be a really simple answer to. And homework is different. It's not the same as being in an office all the time. Some people really like it, some people really hate it. I used to hate it because I used to live on my own. Working from home when you live with other people is much nicer because they go out to work. I'm now in a situation where I'm trying to work from home with other people around me, and you might be able to hear my dogs barking in the background because somebody's just obviously come to the door at the most inconvenient moment, showing exactly what happens when you're home working. You're in the middle of something important and you get an interruption. My mum, I love her dearly, but she hasn't got the idea that when I am working from home, I am working. I do not have a time for a half-hour chat during the day necessarily. Now, in these uncertain times, I have made sure she's in her 70s, she's at risk. I make sure I make the time to have a conversation with her regardless of what I'm doing, because we never know when that might be the last time you have a chat. However, I still have set boundaries that I can't talk to you now because I'm in the middle of teaching my daughter how to do phonics, or I'm trying to do this. So making sure that you keep your space from people in that connection and that they're connecting with you in the right way can help as well. If you can find a dedicated workspace, even if it's a corner somewhere, and then when you're at the end of your working day, shut it down, leave it alone, don't go near it. Give yourself some actual physical distance between the thing that you're spending your day working on and how you're actually spending your normal life. Try not to have it in your bedroom. That's the place where you sleep. That's never going to be helpful to your sleep, and I suspect my other colleagues on the call who are experts in that would agree with that. Plan how you're going to share the resources around. So most people do have 2 laptops in the home. I know people who've only got 1. If there's 2 of you trying to do a call at the same time, that's not going to work. How are you spreading out the household chores? One of the things my husband and I discussed the other day, and I came up with a light bulb moment of, we've lost the balance in our relationship. So he's still working full-time for a company. I am trying to work on my business, not really going that well in terms of the amount of work I'm getting done, and I'm homeschooling. I'm also doing most of the washing, the cooking, the cleaning, and all those wonderful things that a 1950s housewife used to do. It's not the job for me, by the way. I can do it. I do not enjoy it. It doesn't give me joy, but it is necessary. Now, while he's doing a job where he's feeling guilty because he's not helping out with the homeschooling, which he'd love to do, we're sitting here going, well, what's our balance of our relationship? It used to be really simple, and we knew where we were and we got that sorted out, but we've got to recalibrate now and work out how we're going to share the time that we have with each other, the time that we have with our child, the time that we have in the household. How are we going to do that to make sure it's the best for everybody? And making sure you take regular breaks. It doesn't matter how long they are, it's the fact that you take a break and that you're moving away from your workspace. Now, my husband has said it's not so much about how many hours he's trying to get up to and working till 5 o'clock, he's trying to keep working until 5 o'clock. Now, that might not be what works for you. You might find that you could work more flexibly and that would work better. His office expect him to be working through certain core hours. So he's finding that a real struggle, because trying to work up to those hours means that he's sitting there going, right, well, what could I do now that takes me to that point? So if you're getting to that point, take a break, move out of the room, go somewhere else, do something different. Can I have the next slide? Thank you. So from an employer's point of view, if you are an employer, I have managed teams remotely previously. Some of them remotely because they're working from home, but also remotely because they worked in different locations. My team was spread in 3 different locations, and trying to keep them together or connecting in the same way was a challenge. So you need to think about, what is your approach? This is what people are going to remember you for. You may have seen that sort of suggested in the press. There are some employers who are not doing well out of this at the moment because of the way they're treating people. This is kind of common sense. So apologies if it sounds a bit like teaching people to suck eggs, but be empathetic, understanding and supportive. You don't know what they're going through. As Jonathan mentioned, everybody has their own personal experience through this. We're all in a slightly different situation with whatever is in our home. I'm grateful I've still got work I can do. I'm grateful my husband's still got a job. It'd be lovely if we both had time where we could spend quality time with our daughter together without having to worry about either of us working. But that's not our reality. I also get that we're a lot better off than people who are having to go out and put themselves at risk every day. But that's also not our reality. So whatever it is for you, that might not be what somebody else's reality is. Have a think about what somebody else is going through. If you don't have young children, you really do not understand how trying to work with a child around can really affect your mental well-being. I have put my daughter on videos and things and educational stuff, and she'll be fine as long as I'm in the same room as her, concentrating on her and available to her. The minute I move away to the office that's right next door where she can still see me, it's mummy, can I have this? Mummy, can I have that? So it really is hard. So listen to your employees, find out what they need and see if you can accommodate that. Trust your employees to do the job they're there to do. They're doing their work because they want to do it and because they feel obliged to do it because they're contracted. But trust them that if they say, I cannot do this by this point, but I will get it done for you here, that maybe they're changing their working hours and being flexible, using the resources in their home. I know some families who both people are working full-time and have childcare responsibilities. Some people are working 8 till 1 for then the partner to take over and work the afternoon shift, and then they're picking up in the evening when the kids are in bed. Talk to your employees, trust them to do their jobs, but also make sure you're supporting and finding out what it is that they need. If you're making decisions in your business, explain the reasons for them as far as you can without obviously spilling state secrets or anything. But if you're furloughing somebody or you're furloughing a part of your group, don't assume that people know why you're doing it. Actually explain it properly and clearly and talk to them about, when we know more, this is how we're going to keep communicating with you. This is what we expect you to do during this period. This is what we expect we will be doing for you during this period, and be really clear. If you're managing people remotely, set your expectations for them. You need to look after these people who are working for you, but it's really hard as a manager, as well as being an employee, to manage this effectively. If you've got performance issues, it's really easy to ignore them at the best of times. It's even easier when you've got to do it over a remote link like this. I have actually done a performance review with somebody via this kind of method, and much better with video. I highly recommend that. But it was hard because you don't have the person in front of you. It isn't a normal way of doing it for most people, but it is possible and it did work. And it meant that I dealt with something rather than letting it fester, which was going to help nobody in these circumstances. We've got enough things going on in our heads without putting extra things in there to worry about. If you are expecting people to work certain set hours, talk to them about that. See if you can come to an arrangement, make sure that they can do that. What are your expectations against deliverables? Are your priorities still the same as they were before all this happened? Are their priorities the same as they were? What is it that you need them to do? What are the focuses? Think about the outputs that people are going, because that's always where they should be, not actually necessarily the amount of time and hours somebody's putting in. If they deliver it in 5 hours instead of 10, does it matter if they've delivered it to a good quality? And balancing your meetings with time for work. This is about, because a bit like my mum ringing me, my team would also contact me constantly. And it's like, that's lovely, but I have work to do as well. If you are constantly having meetings and Zoom meetings and telephone calls and instant messages and all this, it's invading your life. You need to put some time in your diary aside, put some time aside for them. Make sure you're putting one-to-ones in the diary for them and that you're having your normal conversations with them. Yes, the check-ins, that's a great idea, but make sure you're not overwhelming people with too many meetings. Too many is worse than not enough in some respects, but you need to be balancing that out for them and for you. That comes back to the trust element as well. You need to check that they're going to be trusting each other, but also use your team. You don't, as a manager, have to do it all. Use your team to check with each other and check in with those people. You know the people in your team who are good at doing this as a natural thing, but also make sure you're supporting them if they are supporting others. Okay.
Great, thanks, Ruth.
I don't think I've got another slide, have I?
No.
No. Does anybody have any questions? I can't see any in the chat.
Okay, Olivia?
Right, happy to move on.
Yeah. How do we do that? Olivia, can you?
Yeah.
Thank you.
Sorry, John, what do you want me to do? Have a look at the chat.
Am I unmuted?
Oh, you are muted. No, you're not muted.
Right, okay, great. So I can go.
I've got
Lovely.
you, me and you are unmuted.
Brilliant. Okay, so thanks for that, Ruth. And the other thing that one of the things that we talked about was the importance of getting the working environment sorted as well. So many people, might work from home for a short time, but actually doing it for a long period of times, if you're hunched over a laptop, that's not really great for your posture. My daughter, who's carried on doing schoolwork at home, and that's been very noticeable for her. You can sort of start to feel that she's getting that sort of sense of needing to really move around. And as an employer, you also have responsibility to make sure that your employees have a good working environment. Now, it might be challenging at the moment getting hold of the equipment to do that, but that is a conversation that needs to be had. And and there are things that we can do practically to improve their working environment. And I'm standing at the moment. I enjoy a standing environment, and I find that stops me being sat down all day. Okay, so another thing, so things that are important for being at home, it's eating well, it's regular exercise, and also the regular sleep routine. So thanks to Joanna Kippax from Why Sleep for these items. That's having a regular routine. That's particularly the wake up times, getting into an early morning light if possible. If you can get outside, and it's a great time of the year to be able to do that. Winding down before bedtime. So trying to avoid late news and light screens, which are going to sort of mess around with your rhythms. Using a to-do list to empty your mind, so you're not going to bed full of thoughts of things that you should be working on. And Joanna makes a really good point. It's okay if you're not sleeping. So what I love about Joanna's stuff is she's very, don't worry about sleep. It's people worrying about sleep that stop them sleeping. So try not to worry about the sleep. And if you're not sleeping well at the moment, that's not, it's not a great surprise because of all the change that's going on. So don't let that stop you sleeping. Making sure that you're exercising as much as you can, and there are some great sort of indoor gym type things that you can do, and commenting on what I said earlier as well. Mental processing is tiring, so it's understandable that you're going to need that rest. One of the other things that Joanna talks about, it's a good day's work or having a good day for a good night. So we tend to think about sleep the other way around, but actually we get a good night's sleep when we've had a good and fulfilling day. So think about how you can tire yourself out. So that comes to the end of that section. So I'm going to ask again if there's any questions, and we've got Joanna's on the line, Ruth's there, and I'm here. So any questions for this section before we move on? Actually, one thing I just wanted to ask, people, are you on here for information for yourself, for others, because you're responsible for them? A bit of both, or for some other entirely different reason, which you're welcome to. So if you just get a second to put in the chat, is it for you, for others, for both, or for something mysterious? Okay, so a few boths coming through there. Yeah, for my team and my family, for both. Yeah, interesting. For self and employees. Oh, yeah, that's a good point. An HR manager looking after everyone. Definitely both. Get some advice out of out for employees. So yeah, wanting to get things out. Yes, interestingly, for themselves, for their families as well, friends and family, for both. Thank you, Julian. Yeah, okay. Yeah, so people looking for themselves and for those that they work with as well. Okay, or have in the family. So let's look at the next section now. So the impact of noticing the impact of mental ill health on co-workers and staff. Let me just find my notes on this. Okay, so So we're talking about mental health here. We're going to look at a moment in the 4 most common mental health conditions. We're just going to review and remind ourselves of some of the symptoms and some of the things that we can do about those. But I just want to be really clear, this is not about diagnosis. It's hard enough for the medical professions to diagnose mental health conditions, let alone us who have got relatively little training and relatively little contact. So don't expect this to be about diagnosis. It isn't. We do have a role to play as friends and family and employers and employees and as colleagues, but it's not about diagnosing other people's mental health conditions. What it is about noticing change. And I think this is really important because when you think about it from that aspect, it becomes more obvious the things that we need to do. So firstly, in order to notice change, you need to know what normal looks like. And then you need to know when it changes. Now, I know that sounds obvious, but if we're not in the position where we know what people's normal like, then we're not going to notice when they change. And the obvious conclusion to that is it's about communication, it's about keeping in touch with people. So both of those require contact and non-judgmental listening. So that's asking people how they are and then listening to the answer, not assuming that they're saying a certain thing or trying to read into something what they're saying. It's just, genuinely asking people how they are and then listening to the answer that they're giving and then taking that on board and working with it. So I wanted to mention at this point, we are working on we're trialing a short questionnaire, which is to help with that check-in process. So there's 12 short questions, people can fill it in. And the idea is they'll get a response, which gives them an idea of where they are. If you remember at the beginning, I said mental well-being is about paying more attention to thoughts, feelings, and emotions that are positive than negative. It's not pretending the negative don't exist, they do, but it's about getting that balance. And this questionnaire helps with that. If anybody wants to help with the development of that and get involved with that, we'd very much like to have a few companies on board working with us on that. So again, let us know in the chat or some other way. Okay. So just before I go on to that, forgive me. So one of the ways of doing that, and if you've heard me talk about anything around this, you'll know I'm a real fan of the Mind Wellness Action Plan. So I don't know if you've come across that. It's the Wellness Action Plan by Mind, and that will be in the resource pack that we send out afterwards. And there's a section for employees and there's a section for managers. And basically, it's about facilitating a conversation. So the point here is that you have a conversation with your team to say, under stressful situations, how does it tend to impact you? So do you, for example, become more disorganized, more irritable, more poorly focused? Do you tend to be late? So we all have different responses to stress, and we have a tendency to know what those are. So this is having a conversation with your team ahead of time, and maybe now's as good a time as any, to go, under stressful situations, how do you tend to respond? Because then what happens when they respond in that way? Because some of those things that I've listed, disorganized, irritable, poorly focused, late, those would all be the start of a disciplinary conversation. You're starting to go, hold on a sec, you're not really performing here. But if you've already had the conversation to say, this is how I are impacted by stress, then the conversation is totally different. It's a case of, when we sat down and had that wellness action plan discussion, these are some of the things you said. Now I've started to notice that happening, and I just wanted to check in with you. Is everything okay? And you can see how much less threatening that conversation is than having to get somebody in and say, I've noticed that your work isn't what it used to be, or noticed that you're not in on time or you're disorganized. So I'd really recommend those Mind Wellness Action Plans. And also, because we're talking about communication, noticing change, it's about, I mentioned about the buddying system. So having somebody who is taking that extra bit of care of you could be really important during this time. And perhaps, as I say, it's either one-to-one or in a daisy chain system. I also heard another suggestion, which was having like an advocate in a team that collates certain responses, so the manager doesn't end up with every individual sort of trying to message them with the same sort of information. And I think that could work in this situation as well. Okay, so as I say, this isn't about diagnosis, it's about noticing. So let's just go through and remind ourselves of, the most common mental ill health conditions, what are the main symptoms and the responses that we would expect. So the top 4 are, so depression, we've already had that mentioned. So it's avoiding, what are the symptoms, well, I'll comment on it as we go through, but it's avoiding contact with family and friends, continuous low mood, feeling hopeless and tearful, lack of motivation, energy or interest, thoughts of self-harm and suicide, lack of attention to physical appearance and hygiene. Now, I don't know about you, but quite a lot of those things are starting to happen just from working from home. It's very easy for those things to sort of to be the case when you haven't got the structure of work like you perhaps used to. What are the responses? Providing opportunity for the person to talk, listen and communicating non-judgmentally, encouraging them to get professional help and keeping in touch by text message or email, and letting them know that you're thinking about them. So the second is generalized anxiety. So this is people having unrealistic or excessive fears and worries about the past or future, and you can see why those would be heightened at the moment. A sense of dread and a feeling of constant on edge. Physical symptoms such as a strong or fast heartbeat, and symptoms may cause a withdrawal from social contact. Again, it's going to be potentially hard to spot in these circumstances, and wanting to escape from situations that are discomfort. So as I'm going through, you can see how this sort of isolation and challenge that we're in really makes each of these scenarios much more difficult. Again, it's providing opportunity for talk, listening and talking non-judgmentally, and keeping in contact. The third is PTSD, so that's post-traumatic stress disorder. That's people experiencing recurring dreams and flashbacks, avoiding emotional avoidance and emotional numbing, and also hyper arousal. And what's the response? Don't force the person into telling their story, listening and communicating non-judgmentally, and encouraging the person to find the sources of support that they need. And finally, suicidal thoughts. I started talking about depression, so I think it's important that we do think about that. So it's people expressing the intent or, suicide, expressing the intent or hurt to kill themselves, feeling trapped, like there's no way out and having no reason, withdrawing from friends and family and society, and sense of anxiety, agitation, and inability to sleep, or sleeping all the time. And some of the responses is taking phrases like, my life isn't worth living anymore, seriously. If you believe the person is in serious danger, then asking them to get support. There's been some updated guidelines that have come out from the Samaritans. Again, we'll put that in the resource pack at the moment. And actually, there's been some updated guidance from the Mental Health First Aid England as well, around support for people working at home. If they're not actively suicidal, encourage them to seek professional support and perhaps book an emergency arrangement with their GP if that's still possible. So yeah, I just wanted to touch on that. So it reminded us of the things that we're looking out for. And I guess the 2 points from there, one is that these are circumstances that are worsened by the situation we're in, and also the importance of communication and the non-judgmental listening that comes out here. Okay, that brings us to the end of that section. So any questions, including the question that was asked earlier, so I'll just go back to that. So one of the questions was, how would you cope with someone who is already suffering from depression? Thanks, Alison, for that question. It's being, it's continuing to be vigilant with the support that you've already got in place. Again, as employers, we've got a responsibility, but we're not clinically trained. So giving them support that they need outside of the organisation, but perhaps being more conscious of the need to keep in touch with them. Perhaps using this buddying system. And I guess the thing is to have the conversation with them. What is it that you as an employer or a friend or a colleague could do to help them with the situation they're in at the moment? That might be, listening more than we would normally because of the challenges that we're facing. What signs might a manager look for in a decline in someone's mental well-being when managing remotely? So I'm trying to just work out, is that because of the remote managing that they condition, or because of the challenges of communication? But I think the same thing applies really. It's about people becoming more withdrawn. And well, I think it goes back to the point I made about the wellness action plan. It depends on that individual. It very much does. So it's having that conversation with people to say, what is it that impacts you? And let's look out for that, and let's check in with that on a regular basis. So keeping that communication up. I think it's being honest about this as well, saying, this is a challenging time. We need to be more vigilant about having these conversations. Just reading some of the other questions here. Okay, thank you, Joanna. If you are aware of a decline in mental health, ask about sleep. It can be addressed and it can make a positive difference. Yeah, so in fact, one of the things that came out of the neuroleadership webinars I've been watching was the importance of sleep. Sleep significantly impacts cognitive function and our ability to cope. So, I mean, possibly even saying, you know, if there was one thing you were going to do in terms of your environment is to think about your sleep, not worry about your sleep because that'll stop you sleeping, but just be conscious of good sleep hygiene. And again, the list of points that we've got there, we're going to be sending out with the resource pack. Tips on how to tell your manager your mental health is declining. Okay. That's a good one. I mean, for me, I'm going to keep coming back to the wellness action pack or plan because it opens up that conversation. It says, maybe if I was an individual, I'd want to say, you know, I'm conscious that these are challenging times. I'm being impacted by this. I would like a conversation with you about how it's affecting me. I'm okay at the moment, but I am a little bit worried. Can we talk about it? Using a rating score can be helpful. Yeah, that's great. Be open and honest as far as you can. Yeah. Okay, I'm conscious we're coming towards the end of the time that we've got allocated. So I will move on to the next bit, which is relatively short because it's more of a signposting exercise. But we will do that. So support available for employees. I mean, it's fantastic. So many organizations are you know, reconfiguring existing material, tweaking it, making it available. And so a few of those that we've got available, I've got in my notes, just bear with me. Yeah, so we've got resources from the Samaritans, there's resources from CIPD that I've put out. There is, I think Ruth's mentioned there's a digital support during coronavirus Facebook group, which you can join, which is offering free advice. There's also the Neuroleadership Institute seminars, which I follow. And I'd say probably most of the organisations that you work with on a regular basis are doing something to create that level of support. There's some great material out from Mind at the moment as well for all employers. One of our early newsletters, I think about a month ago, we sent out all of the information that came out from Mind. And they've also made some available specifically for small businesses as well, which is particularly pertinent. So were there any other resources that anyone else has got that they'd like me to, that they're aware of, that I could share with everyone? Put that in the chat. Okay, so as we come to an end here then, I would like to thank you all for being here. So it's great speaking to an audience rather than talking to myself. Hopefully you found that useful and the approach that we've taken, sort of trying to understand the principles behind the well-being rather than necessarily going into the detail. So say if you like the pack, please do shout. Thank you. Somebody's already said that they'd like to help with the questionnaire. And if you like the newsletters, again, very happy to get those out to you and to share what we have as this continues. And I'll have a chat with Olivia as well, potentially running another one because things are changing so quickly.
Yeah, thank you, John. I think a lot of people are just sort of commenting that they would like they'd like to have the pack. So once you send that across to me, I will send the pack out to everybody that's been in this group. I hope that's okay with everyone. I think everyone's pretty much asking me to anyway. On response of that, I'm just trying to think of the best way to manage. Can you, if you would like to be put in touch with John to sign up to his newsletters, can you reply to my email with the pack, and I will then pass you John's information so that you guys can get in touch, and I will introduce you both if that's okay. I think that's probably the best way to do it.
Great.
Okay. Well, I just wanted to say thank you to John, to Ruth and to Joanna as well for all participating and sharing their material. A big thank you to all of you for attending, and I hope to see you all again soon. We have a seminar next week which is focusing on leading through change during the crisis as well. So if any of you have got any teams, or if you've got some managers that are struggling a little bit, please do point them in the direction of that one. That's taking place on Thursday at midday again. You just need to book on the same as you have done for this one. A couple of people commenting that they think some webinars on sleep specifically would be very good. So I will have a chat with Jon and Joanna about that and look at getting that booked in as well. But for now, I just want to say a massive thank you to everybody. I do hope you enjoy the rest of the day and the lovely sunny weather, and I look forward to seeing you all again soon. Thank you.
All right. Cool. Bye-bye.